This presentation has been given as an introduction to some of the physical illnesses that often occur as a result of mental illness and is to assist families and caregivers in providing support to their loved ones who have a mental illness. If patients are empowered with the knowledge in regards to the prevalence of the many physical diseases related to mental illness, they will be able to make the right choices in regards to their treatment, lifestyle, medication management, and enable them to have an improved quality of life. If caregivers are educated about the physical health consequences of mental illnesses, they will be able to better support their loved ones in making the right choices in regards to their lifestyle, medication management, and quality of life. Individuals with a mental illness have a lower life expectancy and higher susceptibility to long-term physical health problems. Through awareness of mental illness and its impact on physical health, patients and their families will have the tools to make a positive change in their lifestyle, which will have a significant impact on their future health outcomes. Very few people with a mental illness are physically active. Over 9 out of 10 are sedentary or physically inactive, compared to 72% of the general population. Almost half of the people with mental illness are obese, double that of the general population. 2 out of every 3 people with mental illness smoke cigarettes. This is dramatically higher than the general population's rate of 25%. The abuse of alcohol and drugs amongst people with a mental illness is far higher than that in the general population. Half of the people with mental illness have metabolic syndrome. This is a collection of risk factors that often occur together and can increase the risk of cardiovascular disease and type 2 diabetes. Evidence has shown that people who suffer with mental health disorders are more likely to have poor physical health. As a family member of a mental health sufferer, you can offer to help and support your loved one to empower them to make informed decisions regarding their physical health. The physical health of people with a mental illness is a predominant issue in mental health care. Lifestyle changes are the primary intervention to reducing the health gap between mental health sufferers and the general population. Evidence that people with mental illness are more likely to have poor physical health, a larger body mass, and a reduced quality of life. Neurological illnesses most commonly experienced by a person with a mental illness are depression, bipolar affective disorder, and schizophrenia. In broad terms, depression and bipolar affective disorder are primarily mood disorders. Schizophrenia is described as a psychotic disorder. Understanding the condition and learning how neurological conditions affect your loved one is perhaps the most important aspect of helping to care for them. Your loved one may have more than one condition or a number of symptoms. Depression is experiencing feelings of sadness, helplessness, and irritability that persist for long periods of time, sometimes without any apparent reason. Depression does not result from a single event, but from a combination of recent events and/or long-term or personal factors. Signs and symptoms of depression are a change in sleep patterns, appetite or weight, poor concentration, lack of energy or motivation, withdrawal from family and friends, increased alcohol and narcotics use, varying emotional state, an inability to enjoy or look forward to situations, and frequent headaches and stomach upset. Bipolar affective disorder is generally characterized by a cycle of mood swings between elation and depression, varying from mild to extreme. Extreme elation is called mania. Bipolar tends to occur in sporadic episodes and may be accompanied by delusions and, in lesser cases, hallucinations. Between cycles, an individual may return to a relatively normal functioning. Bipolar can occur at any point in a person's life, but usually has an onset before 30 years of age. Signs and symptoms of bipolar affective disorder can include elevated emotional state and energy, impairment in judgment, inappropriate behavior, disordered thought, difficulty concentrating, decreased need for sleep, pleasure-seeking behavior, and delusions or hallucinations. Schizophrenia is described as a psychotic disorder. It typically develops in late adolescence or early adulthood. It is characterized by disturbances in a person's thoughts, perceptions, emotions, and behavior. There are a number of signs and symptoms that are characteristic of schizophrenia. No one symptom is common to all people, and the expression of symptoms varies from one individual to another. People with schizophrenia are often not fully aware of their condition. It may develop gradually or have a sudden onset. Signs and symptoms of schizophrenia include delusions, hallucinations, disorganization, confused thinking, social withdrawal, lack of motivation, inappropriate responses, and a lack of insight. The exact cause of depression, bipolar affective disorder, and schizophrenia are unknown. However, contributing factors may include genetics, drug use, social stresses, and chemical imbalances in the brain. Sometimes people with neurological conditions use alcohol, tobacco, and other drugs to self-medicate their condition. While it might provide short-term relief from symptoms, in the long term it can actually make the condition worse and may cause new complications and symptoms such as dystonia, tardive dyskinesia, peptic ulcers, and gastrointestinal cancers, which will be discussed in more detail later. Here is a table displaying some of the treatments available for depression, bipolar affective disorder, and schizophrenia. Medications are effective for most people and help relieve some of the symptoms, but it doesn't cure the underlying problem. It is recommended that the medications be used in combination with other treatments. Family and friends of the person being treated should be aware that many of the medications used to treat these conditions can have adverse effects, ranging from minor to serious. Family and friends need to be attentive to any unanticipated changes the patient experiences, so they may be brought to the attention of the patient's doctor. Factors that contribute to neurological conditions in people with mental illness include high rates of head injury, excessive alcohol use, and antipsychotic use. A head injury can be counted as a blow to the head, like an accident or a fall or an assault. Excessive alcohol use increases the individual's vulnerability to seizures, and antipsychotic use lowers the seizure threshold, which may cause further neurological damage. Dystonia is a neurological movement disorder causing involuntary muscle contraction. Dystonia is classified as primary, hereditary, or secondary. Causes of secondary dystonia include birth injury, certain infections, and reactions to drugs, trauma, or stroke. Tardive dyskinesia is a serious side effect that occurs along with treatment using antipsychotic medications, resulting in involuntary muscle movements or difficulty in performing voluntary muscle movement. Evidence suggests that people with mental illnesses are not being adequately screened and treated for conditions such as dyslipidemia, with up to 88% untreated, and hypertension in people with a mental illness, 62% remain untreated. Self-stigma and side effects of medications used for schizophrenia and other mental illnesses cause these patients to overlook healthy food and lifestyle choices. Cardiovascular disease refers to the diseases of the heart and blood vessels and includes conditions such as coronary heart disease, cerebrovascular disease, heart failure, rheumatic heart disease, and hypertension. It is one of the largest health problems and the leading cause of death in Australia. People with mental health illnesses have the highest rate of hospitalisation and death resulting from cardiovascular disease in Australia. People with severe schizophrenia have approximately 12 to 19 years reduced life expectancy. Cardiovascular disease is the most common cause of premature death in these people. Lifestyle factors and the side effects of antipsychotic medication result in a high incidence of cardiovascular disease in people with mental illness. Type 2 diabetes is a metabolic disorder that affects blood glucose levels as insulin resistance occurs, potentially leading to further disease processes such as kidney and cardiovascular disease. Those with bipolar disorder, depression, and schizophrenia are at significantly higher risk of developing type 2 diabetes. Due to a sedentary lifestyle, poor diet, decreased exercise, and side effects of medications, people with a mental illness are at a higher risk of developing type 2 diabetes compared to the general population. Adopting healthy lifestyle habits and discussing medication options with your doctor will assist in the prevention and treatment of type 2 diabetes. The invasion of pathogens and their multiplication in a bodily part or tissue may produce subsequent tissue injury and progress to a disease through a variety of cellular or toxic mechanisms known as infection. People with mental illness have higher prevalence to different types of infections, including urinary tract infection, upper respiratory tract infection, pneumonia, hepatitis B, hepatitis C, and HIV. Significant barriers to prompt and appropriate medical care for infections still persist for patients who have a mental illness. Research has shown that people who suffer from mental illness are more likely to participate in behaviors such as smoking that may lead to chronic health conditions in the future. You can help your loved one maintain their respiratory health and reduce the risk of developing these chronic conditions by encouraging them to minimize their cigarette intake. It is important that you support them during this difficult time of change. By promoting an increase in physical activity, their respiratory health will also continue to improve. People who suffer from mental illness are more likely to participate in detrimental health behaviors such as smoking that can lead to chronic health conditions such as emphysema, bronchitis, pneumonia, and chronic obstructive pulmonary disease. Smoking is highly prevalent in those with a mental health illness. As a family member, you should try to encourage your loved one to quit smoking, as studies have shown that there is significant correlation between ceasing smoking and improving respiratory function and decreasing the likeliness of disease. Improving physical activity will also improve respiratory health through improving aerobic capacity. Peptic ulcers are caused by the break in the protective lining of the stomach or duodenum, caused by infection with the Helicobacter pylori bacterium. Other factors that may result in ulcers are drinking too much alcohol and the use of certain medications. Gastrointestinal cancer is a term that encompasses a group of cancers that affect the gastrointestinal tract, such as the esophagus, the stomach, the liver, and the pancreas. Factors that increase an individual's risk of gastrointestinal cancer include smoking, excessive alcohol consumption, increasing age, chronic pancreatitis, and obesity. Oral health is often overlooked and is a significant health issue of those with a persistent mental illness. Compared to the general population, people with a mental illness are at a very high risk of gum disease and the loss of all of their teeth. Poor oral health can occur as a result of disease processes associated with mental illness, such as cardiovascular disease, diabetes, medication side effects, malnutrition, and reduced motivation in self-care. Oral health problems need to be addressed not only for the physical aspects, but also as a poor oral health can have a significant effect on an individual's self-esteem. It is encouraged that you speak to your doctor about any concerns or questions you may have regarding your loved one's health. It is important that family members and carers are included in the planning, organisation, and management of the family member's health care. Family members can help identify what triggers episodes of depression and mania. If you are caring for someone who has a mental illness, you may need a range of services to support you and your family. Many available services will help maintain and improve your quality of life. It is therefore important to find people who can answer your questions and talk you through any difficulties you may be having. As a family member of a person with a mental illness, you may notice significant changes in the physical health of your loved one. You can help promote a healthy lifestyle by encouraging a change in lifestyle, eating habits, and physical activity. This will assist in improving muscle tone, body composition, physical fitness, while having a positive impact on cardiovascular health, respiratory function, and aerobic capacity. Getting involved in activities with your family member will provide support and promote the involvement in activities, facilitate social interaction, and improve moods, which will greatly benefit those suffering with depression and anxiety. Remember, making positive changes in your own health will make the transition easier for your family member. Listed here are some well-known, trusted, and easily accessible mental health organizations that will provide information and give advice on how to access further information or to get help where it is needed. It is recommended that you talk to your GP or another trusted health provider if signs or symptoms of mental illness arise.